The CDC says the maternal mortality rate for Black women in 2021 was 69.9 deaths for every 100,000 live births. Data showed Black women were at a significantly higher rate of maternal mortality than other races. Fox 43's Sarah Williams joins us live in the studio with how medical experts are trying to bring awareness to this issue. Good morning, Sarah.
I'm about to.
Good morning. This week is Black Maternal Health Week, and it was first founded by the Black Mamas Alliance organization to advocate for policy change, research, and more support for Black women. According to doctors in our area, the number of pregnancy-related deaths for women of color has not decreased in the last 3 decades. Black women have a 3 times increased risk of dying compared to their white counterparts. Dr. Tanya Wright, an obstetrician and gynecologist at Penn State Health, says the leading cause of deaths for Black women is cardiac and coronary conditions. 2 more doctors say underlying and pre-existing conditions like hypertension and diabetes can also contribute to the maternal mortality rates. Among the physical health of Black women, all 3 doctors I spoke with from UPMC, WellSpan, and Penn State Health say there are care practices that can ultimately make a healthy pregnancy challenging.
We know that Black women are more likely to have limited access to care, especially in the pre-pregnancy period. They're also more likely to have financial gaps and insurance coverage related issues.
I wouldn't just stop at insurance. I would also talk about, food insecurity, housing insecurity, other things that really impact the outcomes of your health more so than, seeing your provider in the hospital.
We have to recognize that systemic racism is playing a massive and major role in health disparities, specifically maternal health disparities. Current inequities like COVID crisis, historical inequities that we saw with Henrietta Lacks and the Tuskegee experiment.
As for a solution, all 3 doctors I spoke with say it starts with advocating for policy change, research, and Black women, whether that's providing free doulas to mothers who would like one or starting the conversation of how to get that number down. Now, coming up in the next hour, we hear from one mother who was diagnosed with lupus, renal failure, and type 2 diabetes, and how she was able to get through a challenging birth. In the studio, Sarah Williams, Fox 43 News.